Hello, I'm Elizabeth Alex with KCU, and today we're talking with Dr. Larry Segars. He is with our pharmacology department. He is a pharmacist and a faculty member here at KCU. Welcome.
Thank you very much.
Let's talk a little bit about prescription drugs, especially with the fact that the DEA Take-Back Day is coming up. If you go through your medicine cabinet, how do you know which drugs you should keep if they're expired, just throw away? How do you figure that out?
So all medications have an expiration date. And that expiration date usually is between 3 and 5 years from the date it's made. It's vitally important that we properly dispose of those medicines.
Should we be underscoring this more due to the opioid crisis?
Exceedingly important, especially for opioids, that if it's no longer needed or there's a few pills left over, that those be properly disposed of.
All right, we have some prescription medications here to talk about. Let's check hydrocodone. It's a pain medication. What about that one?
So it's important that these be properly disposed of and no longer available, especially if it's expired. But if it's no longer needed, wanted, or intended for you, we should get rid of all prescription medicines, especially narcotics.
What about like antibiotics?
It's important not to retain any antibiotic pills or liquids that are left over after therapy is complete. We want to make sure we take all of our therapy so that the infection is properly treated.
Okay, and then what about the over-the-counter things, like an aspirin or something like that?
All medicines, both prescription and over-the-counter, have an expiration date. Aspirin will have a very vinegary, pungent, very bad smell. So if it's gone bad, you will instantly know it when you take a big whiff.
For all of these medicines, is it imperative you take it somewhere safe, or can you just throw it in the trash?
Well, the best thing to do is to keep it out of the environment. And the DEA finds it very important to properly dispose of those. They set up twice a year community-supported drug take-back days where patients, family members can take over-the-counter or prescription medicine to disposal locations and turn those over, no questions asked, so that they're properly disposed of.
Okay, well, we've been talking about the DEA Take-Back Day and the proper disposal of prescription medications. Thank you so much for your insight, Dr. Segars.
My pleasure.